Now for the staging of periodontitis, we need to look at the number one thing is the clinical attachment loss. If the clinical attachment loss is not available, then the radiographic bone loss will be used in this case. Now, if you see a patient, he is having a horizontal bone loss. It can be either stage 1 or stage 2 periodontitis. But if you look at the clinical attachment loss, if he is 1 to 2, then it will be stage 1, or if it is 3 to 4 millimeters, then it will be stage 2 periodontitis. So the most important thing is to look at the clinical attachment loss. Now, regarding the radiographic bone loss, it is grade A if the bone loss per age is less than 0.25. So you need to look at the bone loss per age. That is the most important contributing factor associated with the grading of periodontitis in order to be graded. Then the rest of the things, smoking, diabetes, these are considered to be extra things that should be evaluated. So here we have a case scenario. A 63 years old male patient. His chief complaint, I want white teeth. He is an ex-smoker more than 20 years ago. His medical history has type 2 diabetes and hypertension, and the HbA1c level is 10%. Now, regarding the staging of periodontitis, they said that he is having a horizontal bone loss, so it can be either stage 1 or stage 2. But they said that the clinical attachment loss is 1 to 2 millimeters. So 1 to 2 millimeters. In addition to that, the horizontal bone loss, so immediately you will say that this is stage 1 periodontitis, and for the HbA1c level is more than 7%, so it is stage 1 grade C periodontitis. Now, how to measure the clinical attachment loss? The clinical attachment loss can be measured via any type of probe you can use. You can use Naper's probe or Williams probe, etc. You will take it from the cemento-enamel junction until the base of the pocket. So you insert your probe, okay, apically from the cemento-enamel junction up to the base of the pocket in order to measure the clinical attachment loss. So we have here 3 scenarios. In the left picture, I will name it as picture A, B, C, as the following. Now you can see that we do not have a gingival recession, it is 0. In the second picture, we have a gingival recession, and it's a positive value. In the last one, because we have gingival overgrowth, so we have a negative value for gingival recession. So the clinical attachment loss is calculated as the pocket depth plus the gingival recession equal to the clinical attachment loss. So here are clearer examples showing you how to calculate the clinical attachment loss. In A, imagine that we have a gingival recession that is 3 millimeters, which is the red line as shown. So the probing depth is 5 millimeter. So the probing depth plus the recession equal to 8 millimeter for the clinical attachment loss in case A. In case B, you can see that we do not have a gingival recession. You see the red line? We do not have a gingival recession. So the recession is 0, and the probing depth is 4 millimeters. So 4 plus 0 equal to 4 millimeter for the clinical attachment loss. Now, in case C, since we have a gingival overgrowth, so we have a negative value for gingival recession, it will be the opposite way around. So it will be minus 3. So the 3 minus 3 equal to 0, so 0 clinical attachment loss. Now, in case we do not have a clinical attachment loss, then we go with the radiographic bone loss and how to calculate it. Now, the radiographic bone loss can be calculated via 2 X-rays, either the bite wing or the periapical X-ray. As you can see in the picture, this is the periapical X-ray. From the periapical X-ray, you will draw a line and you will measure it. As you can see, the purple line is the radiographic bone loss, how much is lost from the bone, okay? And the pink line is the total root length that is measured. So 8.5 divided by 16.6 for the total root length that we took it, times 100%, which is equal to 0.512, is the bone loss that is. So the bone loss for this patient is 0.51. Okay, you can say 0.51. And you can know that. Now, if you remember, for the grading of periodontitis, we have the bone loss per age. So the bone loss, we calculated it. Now we divided by the age of the patient. So 0.51 divided by the age of the patient, in case that he is, for instance, 63, 68, 58 years old, then this will give us the bone loss per age at the end under the grading of periodontitis. So the formula goes as 0.51 divided by 58, that is the age of the patient that we predicted, for instance, times 100%, you can multiply it in order to get the answer as 0.87. Now 0.87 is the bone loss per age. Now under the grading of periodontitis, it will be grade B, not grade A, neither grade C periodontitis. Thank you all for watching my video. If you enjoyed, don't forget to hit the like button, comment down below if you have any questions, and don't forget to subscribe for more videos. Goodbye.